The clock says it's 8:01. We're scheduled for 8 o'clock, so I'll call this meeting to order. Do the certification of open meetings. I did not get the latest for the time change into my computer, but Mary, you're certifying that that's all out there, right? Okay, good enough, thank you. We have a 16-item agenda. Looking for.
I'll second.
Okay, motion second. Questions, comments, additions? All in favor, say aye.
Aye.
Opposed? Carried. Adoption of the previous minutes from March 3rd, 10th, and 17th.
Move to approve. Second.
Any questions, adjustments? Hearing none. All in favor, say aye.
Aye.
Aye. Carried. Next item is the public comment period. Members of the public will have a 15-minute block of time to comment on today's agenda items. Members may be present in person or call in to make such comments. To comment by telephone, please call 715-538-1894. Public comment may be extended or curtailed at the discretion of the committee/board chair after advisement. Anybody in the room wishes to comment on our agenda today? Seeing no hands, we'll leave the phone call part open for a few minutes, just in case, and we'll move on. County sales tax update. Pretty good. Yep. Yep. Looked like we were holding our own. Yep.
I didn't get a packet.
A little early to have much of a trend yet.
Can't find any.
No other questions on that. The general fund update, anything there from anybody? Don't believe there was any changes, was there, from last month? Or was there? I can't remember now without looking again.
No, it's the same.
No change.
Okay. Any other comments on the general fund?
Oh, there it is.
Okay, hearing none. Consider it okay and move on. Department reports and/or requests. Land records, Ann.
Good morning.
Morning.
Did you guys get my report in your packet?
No,
And I didn't print any out. I apologize.
that's good, we're saving paper.
I can email them to you right after this. As usual, my report always starts with the project we work on. And then, excuse me. I wanted to highlight that our grant payments came from the state of Wisconsin. The base budget grant came in at $64,480. I just got that on Friday. Also got a $1,000 training grant, and we're still looking to get the $20,000 strategic initiative grant. I did submit our boundary collection to the state of Wisconsin, and I also submitted our statewide data collection, which is parcels, addresses, roads, boundaries, zoning, in the state format. We are also looking forward to a 2026 aerial flight, and we'll have a meeting in Black River with surrounding counties, May 8th, 2025. I use our grant funding for that, and there's possible more grant funding that we can apply for. One thing I did want to also highlight, even though you don't see what I'm looking at, Tess has been working a lot with a lot of the local municipalities, creating maps for them or map applications for them. She created a zoning map for the village of Strum. She created a tourism map for the county here, county tourism map. She assisted the village of Trempealeau with adding new zoning layers and printed a large zoning map for them. She created an address and road map for the village of Oliva, created a road map for the town of Gale, created an address map for the city of Galesville, created an emergency management map for the new emergency management director, created a road map for the sheriff's department, and then created a revised Petrick Park plan map. Also, she's been doing a lot of data requests for example, Mississippi Regional Planning Commission and UW Extension. she's been busy, because when I'm busy, I just pass everything off to her, so. The other thing I wanted to mention is Nick, our real property lister, is serving his second year on the Wisconsin Land Information Association Board of Directors. He is involved in the annual conference committee, fall and spring regional meetings. He's the treasurer for WLIA. He is the chair of the Wisconsin Land Information Association Legislative Committee. So right now, he's currently working, I have two things I'm gonna read from him. He's working on the Act 235 trailer legislation. It's been referred to the Senate Judiciary and Public Safety Committee, which is chaired by Senator Weingard and Vice Chair Senator Jesse James. He's been working on that, and then also he's looking to increase our base budget grant funding from $100,000 to $175,000. Increase our training and education grant from $1,000 to $5,000, and redistribute approximately 15 to 16 million real estate transfer tax dollars allocated to the Wisconsin State General Fund back to WLIP fund through contribution-based grants, which will be a new grant for Trempealeau County's Land Information Program. I just got this hot off the press, so I'm not really familiar with it. Let's see if there's anything else from that. He is working, I thought he had the senators on here, but he's working very hard to increase our funding, and he's working hard on that committee, so we're really proud of him at the Land Information Association. Coming up, we have the Driftless Area GIS Users Group on April 25th. We have the aerial, the W-Rock Regional Aerial Flight is May 8th. Meet me at the Coroner Surveyors Forum is May 29th. Our Spring Regional WLIA is June 4th through June 6th. And the Wisconsin Land Information Association Network, LION is short for that, is June 4th. As for myself, I'm preparing for a new tax and assessment, the whole department is, software. Started working on the 2026 budget. I did complete that 2025-2027 land records plan. I do have an upcoming local emergency planning committee meeting coming up on May 29th. I can't remember if I mentioned that. Besides that, I will email these to you as soon as I get back to my desk so you can look at it. Is there any questions?
Anybody? I have a minor one. Early on, you talked about more grants that you can apply for. You are actively looking at those?
Yes. So the W-Rock, which is the Wisconsin Regional Ortho-Imagery Consortium, they were going to have that meeting, and they found some ways, which is Ayers Associates, have found some ways that we could possibly get some more NG 911 funding for the aerials.
Sounds good.
Yeah.
Anybody else with any questions? Thank you, Ann.
Yeah. Apologize again.
County Clerk, Mary, with
Good morning. So county clerk updates. In 2024, we did 118 marriage licenses. We have Youth Government Day coming up this month, where we will have at least 55 students coming to learn about the courthouse and about just government in general. We've got a pretty good program set up. We're working with UW Extension on that. I've got a new employee starting next Monday. Our election deputy will be starting, so we've been working kind of shorthand. Holly's been picking up the pace and doing more. I've been trying to stay a little bit later and come in earlier, try and get stuff done, so we'll be happy to have a new employee coming in Monday. Just finished 2 elections this year. That was kind of a busy time, so I'm glad we're wrapping up the second election. We're looking at marriage licenses, wanting to do, Holly did some research on surrounding counties and counties throughout the state randomly, not all 72, but looking at raising the rate for the marriage licenses. We're one of the lowest in the state at $60 for a marriage license. Other ones charge up to $120, so we're kind of behind the times there. We're looking at changing some of the language and incorporating what other counties have done. We'll check with Corp Council to make sure we do it all legal. We're looking at, as far as when we have birth certificates or death or divorce paperwork that comes in foreign language, it puts us at a disadvantage. We don't know what you can make out some of the information, but sometimes it's difficult on our end, and it's hard for us, you don't want to guess on a legal document. That's the last thing you ever want to do. So there's language from other counties they have about having certified or notarized translations of documents. That would be a good thing to have. So I think we need to change our language to make that a little stronger, so me and my staff are not set up to fail in any way in that direction. I've seen that some places do a nice checklist for marriage licenses, so they know exactly what they need and when they need it, so they only need to come in one time. We're also thinking about doing it by appointment only. I know that was kind of, it's nice if you need to come in without an appointment, but it helps our schedule, and especially when working short-staffed, to have an appointment, to know that at 1 o'clock today, we have to make sure that one of us are in the office to be able to do that type of a thing. Like right now, the office is closed because we're both up here. So if someone comes in this morning to do a marriage license, the note on the door says, come back after 9:30. I don't want to waste people's time, so it's kind of nice if we have appointments. So we're just looking on changing up some language regarding
Yeah.
marriage licenses.
That would be something that your office can just change your policy, correct?
Yep, so
Okay.
we'll be working with Corp Council on that to make sure everything is done on the up and up. Other than that, like I said, new person coming in, 2 elections are done. To a point with the public, they're done now. It's after the fact, getting the voters in the WIS votes and type of thing. So we're managing.
Good.
With that fee change, would we have to be involved with that, or you can just do that for the marriage license? If you're going to raise the fee?
I would think that we'll be doing a resolution on that then. And I was, when Paul was kind enough to stop in one day a couple weeks ago, I asked him, because a certain amount of that $60, a certain amount goes directly to clerk of
Right.
court
Right.
and to the state, so we don't get to keep that 60 already, so,
Okay.
yeah. But stay tuned.
Okay. One other, you mentioned earlier about the students coming in. Is that college students, high school
High
students?
school students, yep, yep. I reached out to all of the school districts in the county. 3 responded, and 1 was with a no. The other ones I sent a second message to, and they didn't respond. I don't know why, but anyway, we do have 55 students coming from 1 school district. They're coming in, so. That'll be a busy day around here. We hope to have Rebecca do a little welcome speech in the morning. That'll be on the morning of the 24th. If anyone's available, they're welcome to have lunch with the kids and kind of talk with them. So I'll be letting the county board know that a little bit more detailed. We'll be, I believe, in the Trempealeau room to have that many people sitting together. The kids, there'll be a speaker like around 11:30 or noon. But yeah, one of the sessions we have with the kids is learning how to talk with representatives. So that would be, if you guys have a chance to sit with the students, that would be kind of a good thing for them to learn and listen and talk with them about that. So also, one of the people involved has her voting machine here, so they'll be learning about voter registration, and then they'll actually be voting on the machine with a ballot geared for them in the afternoon. So they'll be actually hands on the machine, so.
Sounds like a good
The
thing.
Legion will be here helping out, so we're very thankful for that,
What was
too.
the date and time again, Mary?
The date is 24th, And the program starts like at 9 in the morning, I believe, and then they're, throughout the day, they're going to different spots, but lunch, I believe, starts at 11:30. But I'll let everyone know that specifically. I'll send out like an agenda for the day, so you're aware of that too.
Sounds good.
Yep.
Any other questions?
I won't be here. I won't be here.
You won't be, well, I don't know if we can allow that. Okay, thank you, Mary. Item 10 is an update on the opioid settlement funds and interest in creating a correctional behavioral health coordinator position.
Do you want to go to 9 first? And
I'm sorry.
And I'll speak instead of Susan.
The lines in the glasses were in the
Yeah.
wrong dang place.
Yeah, I know.
The meal reimbursement says Susan was going to do that.
Right, and actually, we didn't need Susan on this, so I had said I'd speak for this instead. And so this committee had already voted and gone through the process of looking at the county meal reimbursement rates at another meeting, had voted on approval of that. This is just an updated resolution. The last time amendments were made to this was 2015, actually, so I think it's long overdue to have a change in that reimbursement rate. So I just wanted to put the resolution in front of you, make sure that you saw that, you were okay with that, and then we'll take that forward to the county board meeting at the next
Do we
meeting.
need another vote from this committee to move it on now that we have it, or is
No.
that assumed?
Correct. I mean, because, yes, correct. As long as everybody looks like it's, you don't have any issues with it, we need to bring it back or anything.
I don't think there's any issues. I think we pretty much resolved it, I believe.
Yeah,
Okay,
okay.
now we can go on to that, and I'm not going to read it again.
Okay. All right, so we have been working with the opioid settlement fund committee and talking about the settlements that have been coming in, and we have a little over $403,000 that have been set aside. Susan is in charge of, identifying those funds and keeping those separate, working with the treasurer's office on that. So the committee is meeting a lot to determine how those funds should be used. And I wanted to bring forward, because you will eventually hear about this, but I wanted to bring forward the position that the committee is talking about right now. The sheriff has brought forward a new position within the sheriff's department in the past, and we kind of talked about it during budget time last year, and not having funding for that position and looking for other sources for that position as a correctional behavioral health coordinator. I think you got that job description in your packets, is that correct? Does anybody want a copy, a paper copy? I do have a copy if anybody wants that. What's that? I do. It's in your packet, but I'll just, in case anybody wants to take a look. There's nothing that you need to,
This is the one from Jackson County?
yeah.
Yeah.
This is
yeah.
Jackson County. So this is an example from Jackson County. The sheriff really thinks that this covers a lot of what would be helpful to individuals that are coming through the jail system that have been dealing with opioid addiction and issues stemming from that, also leading into, of course, there'd be therapy and things, crisis management, but also, and besides counseling and things, would be job work, training, and ways to get someone acclimated back into the work environment once they leave the jail so that they're more successful. So we're still having conversations about this, but I wanted to just bring this to you because it seems as if the committee is moving forward in that direction. The $403,000 would be used to offset those costs to at least get it started. We're also looking at a couple of grant opportunities that might be, that we could bring in to also make this position last for quite a while for the county. So I think overall, it's a good opportunity, and the funds are set aside, and we will have funds coming in for a period of time as well, yearly. Not enough to cover a position, but I think if we have, if we have some grant funding also, it could be something that we're able to see continue for quite a while.
That sounds good to me. Sounds like a good position. It looks like we have sufficient money to start it and run it for a couple of years at least. I would be concerned about when these funds run out, that it doesn't end up going back on levy. That's where my concern would come in. As long as we go approach it with that in mind.
Yep.
That it would not become a levy situation, I'm in favor of moving forward with something like this.
Okay. Yeah, I would agree.
Question for Rebecca. In our opioid committee, I had asked about this position, and one of the questions that I had was for actually Sheriff Semmingson was looking at, because he had mentioned before that potentially there would be some time, depending on how many inmates were in need for Trempealeau County, of having time to do community outreach in regards to opioid. I do see in part of this job description, there's a perform public relation functions. But I think what I'd like to see is at least something in there and closer to the top of the duties that they find or adjust the time, that definitely they're not waiting for an inmate to come in, that in between they are doing other functions for out in the community.
Community outreach.
Whether they attend, I don't know if they want to jump on with badges or whether they want to, but I know Sheriff Semmingson at one point said that they probably would have time to do some of that community outreach. So if we could get, I don't know if it's 10 hours or 5 hours a week or some sort of commitment from the sheriff that that's how that will be utilized, then yes, I'm in full favor of this.
Good. Yep, I think that's a great discussion point, that as we continue to build the position, this is just Jackson County's example, but we can build the position to what we see we need. So I think that's a great suggestion. And so this is just for information. Don't need any vote on it at this point. The committee's still working through that, but I wanted you to be aware. I think it's a good step forward.
It'd be nice to have a little breakdown of the financial part of
Yep.
it too. See what they're gonna get paid, see how long this will last with the money that we have, so we got idea of what's going on, and we just going into it.
Do we have any kind of a guesstimate of what kind of yearly monies are do we have any? There's some of these that go on for 5 and 10 years or maybe even more. Haven't looked at it recently. Have we put together anything saying, the next 2 years, we're going to have this much money to go into the account or anything?
Right. So I have talked to Susan about that, and I don't know how long it goes, but she is saying for the next several years, anticipating, and she doesn't want to put a number on it, but it could be about 50,000 a year is what she's
Okay.
conservatively thinking, so.
So if you take that number with what we have and the potential you say for some grants,
Yes,
it
correct.
could last a long time.
Right, yeah. And so we're working with the health department and searching out those funding opportunities as well, so we'll continue on that path.
Is there, just an idea, is there any way we could share maybe the person's hours limit with maybe the county hospital? They have a need for anybody that's got a degree in social work and with their, people at the county hospital, where they could pick up some of the costs, so we could stretch this out maybe a couple of years farther, you know, or even maybe with the school, so we can go around and talk to the kids about the bad thing about opioids. And, you know, I mean, I think there's a couple different avenues we could go here just to help maybe get some funding from outside sources, and then they
Right.
could maybe stretch out the job for a couple more years longer than what
Okay.
we have the money for.
Just a comment, you know, I guess it's no secret that anything that this would improve the situation can save us a lot of money. That's with health, human services, the jail, obviously, so there's potential to save us some money.
Yeah, I think anytime we can help someone become and, you know, put them back into society and working and a part of the system again and paying in taxes and successful in their lives would be good overall for all of us.
Just for information, we have to do something by the end of the year. It has to show obligation of the funds, or, so that's why the urgency to get it going here, get something going.
I guess move forward and come back and let us know how we're doing,
Very good. Sounds good.
okay? Now, item 11, Innovation Planning Grant in partnership with the Village of Trempealeau. Research possible IT collaboration.
All right, I'm going to, again, pass around, this was a innovation planning grant summary, project summary, and just to give you a little background, this is coming out through the state of Wisconsin, through the Department of Revenue. There's a large sum of money that's going to be available in July for innovation grants. And there's a variety of different uses that we can apply for to use those funds. Currently, they're allowing applications for planning grants, and it's only for communities under 5,000 population. And so the administrator from the Village of Trempealeau and I spoke. We had some conversation in discussion about how could we look for efficiencies in our county and working together. And one opportunity that we were interested in, at least, was to talk about IT. And I know from my experience in having IT services contracted out, and that's what I had formerly done at the city I was at, is that I often felt like it was very, working with a private group, it was very reactionary. We didn't have a lot of planning. There's a lot of sales, of course, and so it's just of interest to me in looking at, could there be a potential for savings to work with a county and a county IT? And so Isaac was interested in the same, and so the Village of Trempealeau then worked with IPA, which is the group that we contracted with for reviewing our media services. So Innovative Public Advisors, and they wrote then for an application to the State of Wisconsin Department of Revenue for one of these planning grants. They have been awarded, and so they would start this spring working with the Village of Trempealeau to work across the county, all cities, towns, villages, to just to analyze and to look at what's the potential for savings, what's the opportunity to work together, or is there not? But it would be, this was a conversation I had initially right away with Tim then and saying, what do you think? He was all on board, he's interested, at least in finding out what potential is there? And so I just wanted to make you aware of it because it kind of came up really quick. There was a deadline, and so the village put in the application, and they've received that. So that's conversation that would be happening. I'm going to give you just a copy of, it's very simple, but it just talks about what they would be looking at.
No. Excuse me, the deadline for applying for this has already passed, so they're in the granting stage? Is that-
Correct. So,
there's-
well, I guess they extended it, so the application deadline was the end of March. They have extended it to the end of April. So there are still opportunities for communities under 5,000 to write for planning grants if anyone has interest. I did offer that opportunity to all cities and villages in offering that the county would help if we had anyone interested in that.
My thought process went to something we've been discussing, the housing issue. Is there anything in strategic planning that a smaller community might be able to look at and apply for yet? That's where I
Yes.
was going with that question.
Yes, I think if there's, if a community still has interest in doing that, yes, absolutely. I think that we could have a similar type of project that would be put together. I think, anyway, this will start up here in the spring soon, and it's a conversation that is led then by the village of Trempealeau. It has to be a community under the size of 5,000 that takes on the initiative, so it can't come from the county, but we can be a partner in it. Questions? I'll pass this out too. Yeah.
Okay, any other questions about this? I'm gonna make a call to Sheila and see if they can get interested in that project.
Well, you're coming up, you should be announcing in a second here.
I'm next.
Any further questions about this? No. Okay. I see Dick is here, so a discussion of the 2026 county coroner election / medical examiner for Dick, with Dick.
Okay. Thank you, Mr. Chairman. Approximately 8 years ago, I think it came to my attention, in fact, it came to my attention through our coroner, Bonnie Kinchy, that in Wisconsin, not only do you need to have a coroner, but you may choose to have a medical examiner. As most of you know, I'm sure, that the major difference is that the coroner is an elected position and the medical examiner is an appointed or hired position. And it came to my attention through Bonnie because at the time, I think we were nearing an election, and she indicated a concern in reference to the preparation or experience of people who may have been running at that time. At least that's my interpretation. And I think on 2 occasions, if I'm not mistaken, she did talk to the executive board, and I think she talked to the board as a whole, if I'm not mistaken, in reference to the consideration or encourage the consideration of an appointed medical examiner and to replace the coroner's position with that position. As I've given this matter thought, there are some real benefits, in my estimation, in having an appointed individual. Perhaps the most significant is that that person, if they are appointed, would obviously have to be experienced, have some preparation, and it would allow us to begin, hopefully, with someone who is ready to rock and roll, so to speak, right at the beginning of their career in this particular county, in this particular position. My concern is, and I shared this with the Personnel Committee, that this matter has been discussed, shared with this board and previous boards, and that it is time now to give further study to it and give serious consideration to move in this direction. We are now in a position to provide space, I think, with the building that we've undergone the last several years, to provide space for that person to office here, as well as to maintain records and files that the coroner is required or should be keeping. So in the past, Bonnie had indicated to me that, or I heard somewhere anyway through Bonnie, that it has been practice that the coroner officed out of their home maintain records in their home. These are, I would assume, and I guess Susan can tell me, these are public or county records, and there is a need to, of course, maintain the safety of those records, which is something that we certainly need to consider and address. So what I'm encouraging, again, to this committee, since you guys kind of deal with the purse strings a little more closely than some of the rest of us, that we further examine this matter and perhaps, and I was trying to give some thought this morning to kind of suggesting some time constraints. As you know, the coroner's position will be voted upon again in '26, if I'm not mistaken. That's correct, isn't it? And in the past, when consideration was being given to a medical examiner position in place of the coroner's position, that discussion took place late, and there was not an opportunity to really seriously consider it and perhaps move on it. So what I would encourage this group to do is to be part of the study along with personnel, since they have indicated their willingness to do so, to also participate in that. And if at all possible, I would encourage that matter be brought back to the board as a whole, perhaps no later than September. Because in fact, I would encourage it even earlier, because if there is a need for further discussion, there needs to be time in order to process this matter and to make that decision in plenty of time so that those people who may be considering running know the position of the county and whether or not there will be a coroner's position. So we have an opportunity, and I want to kind of encourage, push you to be involved in that process of investigation and allowing the board as a whole to consider your findings and to decide whether to move in that direction. And I would be very happy to, if you need any assistance, to participate in that research and try to find that information. I think there's some valuable potential in moving this direction. There may be some very big negatives, and I think we need to be looking at all those things. I haven't researched the matter with other counties or with the Counties Association to determine, the numbers of counties that have moved that direction. again, it would give the county an opportunity to be involved in helping to locate people who are prepared, perhaps educated in that whole process, or have the background. And also, one thing that I think has been part of this county's desire is to encourage our staff to have further education to better prepare them to exercise their assigned role. So that's my comments for the day, and if you have any questions of me or I would certainly try to answer those, but I do encourage the executive committee to participate in this attempt to at least do a thorough study of that particular issue. Thank you.
Doc, you have a question? Go ahead.
Fair or not, but the first question is cost.
That's where you guys come in.
Yeah, it's going to be more, right?
Not necessarily.
I think it's unknown at this point.
Okay.
My understanding, and I haven't talked to anybody recently, I think Mary is here, so she maybe can answer that. I'll put her on the spot. Currently, the coroner's position is a salaried position, plus for every case she works on, she's also paid. So I don't know what the total is, and Mary would know that. So that'll, give you an idea that there are other expenses besides the salaried part of it. And there are some deputy coroners, but my understanding is they are only compensated if they go on a call to deal with a death call. So there are those employee expenses. One of the costs that perhaps has been going up, at least it used to when I served on the executive committee, is that the cost of sending someone to a medical doctor for autopsies, and especially if it's a autopsy that, what's the right term for the autopsy when you may have a court action, or it's a more thorough autopsy, and that is costly.
We're a long ways from getting to an end here, but I believe Bonnie's the coroner for Jackson County also, is that?
She's a medical examiner.
Okay, so that's
She is
different.
contracted or hired by them.
So if we switched, it makes sense to look at another county, but I guess we got to get some numbers.
No, that is certainly, I would assume that's an option. And Susan is here, and she can, she will, at some point, I'm sure she will be very happy to give you the information, the legal information regarding the process of setting this up and what kind of arrangements
Right, okay.
may be established with other counties. Yeah, which is not a bad idea.
Right.
I think that way there's a potential of having an opportunity to retain perhaps a more highly educated person in the area of the medical field and so forth.
John, I see your light is on. Did you have a question, or it's just on?
No, I was just going to say that actually Bonnie brought this up before the last election, that she thought it should be turned into a medical examiner, partly because she just got sick of running around getting signatures and everything else you need to run for the job.
Yeah, I think she had,
And then it got to be people really who are not qualified would run for this position. I suppose anybody could figure out, well, this person's dead, but there's more to it than that. So I encouraged her to come as a write-in, because if she didn't sign up as a write-in, she wouldn't have been the coroner either, so.
and I guess I would want to make it clear to this particular committee that this matter did come from, in fact, the education that was provided to us came from Bonnie, that is an option, and that this is, I guess I'm recommending this consideration because I think we need to look at the future, and I don't think it has any, what should I say, any comment regarding Bonnie's performance. I'm not talking that way. But I think it is time to be looking at that, and since she did retire, so to speak, momentarily, until you talked to her, John, and that this is an opportunity, and with the election not coming up until late '26, this gives us plenty of time to hash this out and know where we're going with this.
I think my question probably is more, but maybe, I'll start with asking it of you, Dick. Is this the right committee to start this? Or if we're talking about a potential employee, I'll call it, should that start with personnel bargaining and come back to us for the cost part? I'm just questioning the procedure.
It did start at,
Okay, you have started, okay.
Yeah, so Supervisor Miller spoke to personnel bargaining first.
Okay.
And then he said he would like to come here.
Yep.
And so I think this is just an awareness and to see if you're interested, and then we can start to research that.
I think we need to look into it. Where it's going to go, I have no idea at this point, but I think we need to look into it. So,
I would agree with them if you're gonna get something done. It has to be
Yep.
done by September, because
Right.
everybody takes out papers again in November, so it's gotta be.
I think they take out papers in April of next year, but the issue.
no, we take
Oh,
out, you have
that's
to take out
election.
papers by December, I think.
By
This
December.
election is next November.
Is it November?
Yeah.
Okay, it's not an April election?
No.
Okay.
But then you said 2026 would be another 4 years.
Yeah, right.
Yeah,
Correct.
she's got a full year yet.
Yes.
Mr. Chair.
Yes.
So I just want to say that I fully agree with Mr. Miller's perceptions here. I think you're talking about moving into the future. I would even say the future is already here. Most counties have already moved, counties of our size have already moved to a medical examiner. Yes, the cost is certainly a concern, but I also think that it's important for the county to do the right thing by its people and make sure that we've got no conflicts of interest or anything like that, and make this position something where we have a trained personnel, albeit our current coroner is very well trained, but it brings up that point of if someone else is elected into that position, they potentially could have no training. Thank you.
Rebecca?
I think sometimes, and just to piggyback kind of off of what Supervisor Turner said, sometimes you also have to look not only at cost, but at what risk or liabilities you're putting yourself into by not having someone qualified. So eventually, you know, again, looking to the future, if you found yourselves in a position where that individual was not a qualified individual, there are some serious liabilities that could put the county at risk by not having an appropriate person in that position.
I think we just need a lot more information before we can even step
Right.
forward, and
And
I
I'm
think
still-
there's
I'm
nothing
still-
wrong with looking into it, but there's a lot of questions out there right now, you know, and I think once we get more information, it'd be
And that's where
a
my
good
question
discussion
comes in,
on it.
is it up to, should it be up to this committee to start that research, or should it be up to personal bargaining to look at the, I'll call it employee aspect of it, and then once that has been looked at, bring it to us as far as the monetary issue? That's where I'm questioning where it should start.
I might have misread this presentation, but it sounded to me like we have a volunteer that's gonna research it.
I would be happy to help. And I agree with you that it probably, that's why we went to that's why I went to the Personnel Committee first. But I think, you know, my service on the county over the years I know full well that this committee is one committee that has a lot of oversight over everything that happens in the county. And to go around you guys and miss you would be foolish on my part, wouldn't it?
Probably.
But I guess what I'm trying to say is you have a better overall view, understanding of how the county is operating than any committee
Right.
in the county, so.
Well, I think this is my thought. We've been made aware. I think my suggestion is that it goes back, probably with you in the lead, if you're willing to take it, to personal bargaining and come up with the research, the pros, the cons, the whatever. And then, once you put that together, then come back and talk to us, and we'll see what the money situation looks like and what it may take and where we potentially may save or whatever.
I think this is something could be done with an ad hoc committee, probably 5 members. You don't want any more than that, really, because if you're gonna get something done, it seems like it works a lot better with a smaller committee.
Yep.
And maybe at our next meeting, we could look for volunteers to work with you on that committee. And you could spearhead it.
And in the meantime, talk to 1 or 2 people from personal bargaining, because they would have a little more insight into some of these things, I believe.
Sounds like a plan. Thank you.
Okay. Thank you. Yep. Anything else on this issue? Okay. Sharing of the 2026 budget timeline. Oop, too much. What do we have?
So we're just wondering about number 13, if we should.
Oh, jeez. I gotta copy this bigger words because I keep missing things. I'm sorry. The discussion regarding the state statute 4618 regarding trustees of county institutions. That's with Dick and personnel bargaining and/or. So apparently you're still here.
I'm not overly prepared, but maybe I can try to hit that. This is the.
You had asked me about this, so I did print out
Okay.
4618, if you wanted to.
Oh, okay. Yeah, thank you. I don't have my copy along here today. The Wisconsin Code
I've got one.
allows for a choice within each county to determine how many members to have on the boards of trustees for the county hospitals. I think that county hospital is the right description, isn't it? I think that's where our facility falls under. And we may have, I think it's 5 to 9 members or something on the board of trustees. Pardon?
3 tonight, it says in here.
Oh, okay, I don't have my, 3 to 9, I'm sorry, yeah. Okay. We've been operating with 5, 3 board members, 2 citizen members. And as most of you know, this facility is Lori, how many $1 million a year? 37? 27. We're operating at $27 million per year, and obviously with inflation, that's going to keep going up. We're operating with 5 members. 3 are, like I say, are elected by this group, 2 are citizen members appointed and approved by this group. I'm encouraging some consideration be given to a board change rule, to perhaps move that to 7. I think our board needs to be better represented on that, in that group. I hear a lot of rumors I'm picking up from various people, including board members, in terms of what's going on out there. And at the time prior to serving on that group, I too had questions because I didn't know what was going on. And I'm not saying anything's bad going on. I'm simply saying that I think we need to have more board representation so there's an overall better knowledge of the programming and the good things that do go on in that facility out there. So I think if you, as you examine our Human Service Department, Health and Human Services now, we have 9. I think we have 9 committee members now on that, in that group. And it seems like 5 is a number that we could increase by 2 with minimal expense and more varied knowledge coming into that committee. And do we have any other committees that are larger than 5? I think it's just the Health and Human Services, isn't it?
Land use.
Land use, that's right.
Yeah,
How many do you have on there? Is it 7?
I think it's 7, isn't it?
7.
I
On
know
which?
you're on it. How many do you have?
On which?
Land use.
Land use, 7.
7,
Yeah.
yeah.
There's
yeah.
2 citizen members, 1 from the.
So anyway, I would encourage there to be some consideration being given to making a change on that. Usually the board rule change recommendation comes from this committee, and as well as review of the board rules. Again, it'd be minimal expense, and I think a better opportunity for better communication.
We have representatives from the healthcare center here. Anybody want to comment on that thought in regard to more members?
Jerry was not able to attend this morning. He had another meeting with the county, so he was not able to attend. So I'm here representing the healthcare center. I have Joe Minch with us. Many of you probably have not met him yet. He's our administrator at the healthcare center that took over for Terry Summers' retirement. I mean, certainly we can review this. And, you know, our Board of Trustees, this will have to be put towards, to them as well for their consideration. I guess I'm a little bit concerned on the comment of the rumors that are happening out there at the healthcare center of what's going on out there. I guess if there are rumors, I would ask that those be brought to us, because at this point, I'm not aware unless, you know, I'm speaking, I won't speak for Jerry. He may have more knowledge of those, but certainly if there's rumors out there, I would ask that those be addressed to us, because we're not aware of what those are at this moment that I know of. And that's very concerning to us, that that would be a reason here for changes for us at the healthcare center. So I would ask for that courtesy to, for those rumors to be shared with Jerry, or certainly the board, or our Board of Trustees president, so those can be addressed.
Can I ask you a question, Lori?
Sure.
Why would there be a concern to expand to two more people in that board? I am getting the impression that you think this perhaps isn't necessary.
No, certainly not. I'm not speaking to that at all. I'm just, this is the first we're hearing about it, and
Yeah.
so I'm not concerned. I don't know that there's any concern at all, and again, I'm not speaking for Jerry. I'm just here representing. Not concerned at all. It's certainly something to consider. I don't think there's a concern at all. We just have a larger board. I'm only speaking to the comment of rumors of what's going on out there. And so I
Well,
would just ask that the board be
I
able
hear,
to.
I guess just to maybe clarify that with you, I do get questions from our county board members who are not serving on that about issues out there, and certainly I try to tell them to the best of my knowledge and respond to their comments. But I think part of the problem is that we only have 3 board members active in that group out there, and that it somehow, I think we could be better represented. And I guess the other thing is, the County Board of Supervisors is responsible for setting the numbers of board members to be out there. That's in the board rules. That's the responsibility of this group. As a Board of Trustees, certainly we can discuss it and we can vote on it, but the decision is made, on the board level. The board is the one that sets policy in reference to the numbers of people that are serving. And the way the law reads, it doesn't define where they come from in terms of the appointments or the election of board members, but it does say 3 to 9, so that gives us that opportunity to maybe increase that coverage and allow the board to be better represented, the county board to be better represented on the Board of Trustees.
A question I would have, though, is would that not be a change to the healthcare center bylaws?
Oh, sure, but it would be
So
easy to
that-
change that.
Sure, so that's what would have to go, would that not have to go back to the Board of Trustees for a change in the healthcare center bylaws?
It starts on this end
We'd have to do a change in the county bylaws.
before it could happen out there.
Yeah.
Mr. Chair.
Go ahead.
In regards to, initially, you were speaking about the amount of what the budget is for the healthcare center. If you're looking at numbers to compare what's necessary, you look at, say, Western Dairyland, which has a budget even larger than that with all the grants and Head Start that's funneling through. And they have over 20 members sitting on their board of trustees. So I don't disagree with Dick, but I also would like, obviously, we can do that by statute, but I would like to hear what maybe some of the negatives of that would be. I'm not sure that there is a negative, because I think that more knowledge for more people is a better thing, not a worse thing. So I guess I would just like to have time to think about what are some of the negatives? Both of you are there, that's what I'd like to hear from you, is what do you feel is a negative? What's the downside of this? Because I'm not seeing any downside at this point. Yep, go ahead if you've.
I would respectfully ask that Jerry be part of this conversation. I think that probably needs to come from him. We did not know the agenda item was going to be presented today until we saw the agenda, so, and he, again, had that important prior commitment. So I would just respectfully ask that Jerry be part of that conversation.
So how do we move from here with this?
So,
Any suggestions?
I would just wait until we get Jerry involved with it.
So we set something up for our next meeting to start talking about this with Jerry? Is that where we want to go?
Personnel bargaining, one or the other. Or both. What do you think?
does it need to go through personnel bargaining? Because this is a county supervisor.
Not for this, I don't think. Okay, come, please.
This is a county board function, and if you look at 46-118, subsection 1, at its annual meeting, the county board shall appoint an uneven number of trustees from 3 to 9. So it's purely county board. And it would be done, we have a little bit of time to do this because it's something that has to be done at the annual meeting.
I would say just bring it back here to the exec finance committee then for further discussion and inviting Jerry to, I would continue the discussion. You have time.
Put that for an agenda item for the next meeting, that we discuss this further and give Jerry time to adjust his schedule to be here. Okay?
Just a question, when is the annual meeting again? November?
Thank you.
Okay. Yep. Finally, we'll get to the next one that I've been trying to get to. No problem. Yep. The 2026 budget timeline.
Yep, this is just purely information because we're already talking about this, working with department heads on budget for 2026. So I wanted to give you the layout of the budget timeline so that you could take a look, and if you had any input, wanted to get back to me about that, just for information. So I'll hand that out to you. So May 1 is right around the corner. And so we're going to update some of our documents going through it last year. Then it's just making improvements and in some of those things. And then out to department heads, May 5.
I haven't got a calendar in front of me, but our May exec finance meeting has to be right in that time someplace. Somebody have the date of it?
Next exec finance would be May 5th.
May 5th, okay, that's the, is that when we will see these documents here then?
Yes, correct. Well, we can do the updated forms. Yeah, I can share those again.
Okay.
I think we did that the last time as well, so I'll bring those forward just for your
Okay,
eyes on them once again.
anybody else have any other questions on this?
Everybody seemed to be really happy with that 8 o'clock.
I'm sorry.
Everybody seemed to be pretty happy with this 8 o'clock instead of 8:30. Does anybody have a problem with making that a permanent deal?
You want to go to 8 o'clock?
It's great with me.
That'd be great for me, I guess, if it's not, I can stay with 8:30 all day.
Doesn't make any difference to me. My cows get fed when I get home, whatever time that is.
They don't get too mad at you?
No, not too bad, not too bad.
You make it, it's perfect for you too.
They'll be out on the pasture.
Works good for me.
Not May 1st for me, no.
Works good.
You gotta,
I get
end
the
of May,
Brian
I
bus
usually get out there.
so I'm right here anyways.
Yeah.
So 8 o'clock it is?
Several reasons for that, but number one, my breeding schedule, I bring the bull in for the whole herd, and
Does
then
that work
as soon
for
as
you,
pastures
Adi?
are ready, I divide them up.
Perfect for me too.
Okay.
Check with the cows and we'll
No.
go with 8 o'clock.
Yeah, what's that?
Check with the cows and then we can go to 8 o'clock?
Yeah, no, they get told what to do. You had some question in regard to this, the request for information for the trustee, all that sort of stuff with the health care center. Did your questions get answered, or do we need, is that some?
Yes.
They did,
Yeah, but by Susan.
okay. Just wanted to make sure before we, Is there anything else? If not, darn, if I'd have just looked down the next line, it says May 5th on here for the next meeting. And we're going to change that to 8 o'clock, is that right? Is that what we want to do?
And that's going to be more of a permanent time.
Yeah.
Yeah.
No, I think by the looks of it, we would have made it at 8:30 and still made it in time to. It's just when meetings started getting moved all over, I said, there's no way this thing is gonna take 2 hours to have this particular meeting. So I said, just move it up a half an hour and we'll keep everything else on schedule. Otherwise, we had to change a lot of stuff.
There's one scheduled for Thursday afternoon on the
What, I'm
calendar.
sorry.
Full
Oh,
board, full
that's
board.
correct, yes, for strategic planning, yes, right. 4 PM here, yes. And that is for the whole board, and we'll have time for a light dinner type or, sandwiches, so just so that you're prepared for that. I was going to send an email out to everyone, but just so you're aware of that, we'll have Subway here, subs.
And then it looks like 7 o'clock.
Yes, we'll be done for sure by then, if not sooner.
Another commitment like at 8, so.
Okay, okay, yeah. Yeah, thanks for that.
Okay. Anything else? Okay, next, May 5th at 8 o'clock in the morning. And with that, unless there's something else, I will adjourn this meeting at 9:14.